Hello everyone. Let me welcome you all to a very small session with me. I am Swathi Sunil, a third year medical student of Anjan State Medical Institute. So today, let's discuss about a very small topic, that is hemophilia. In this session, I'll be discussing with you about what exactly hemophilia is, some of its genetics, its types, then pathophysiology of hemophilia, the clinical features, the diagnosis and its treatment. Now, what is hemophilia? Hemophilia is a bleeding disorder. Yes, hemophilia is a genetic or inherited bleeding disorder. Now, what causes this hemophilia? Before telling you what causes hemophilia, let me tell you that for us to stop bleeding, the main or one of the necessary factor required is our clotting factors. So, what if I tell you there is some problem with the clotting factors here? Yes. In hemophilia, there is a dysfunction or deficiency of some of the clotting factors. Now, which are clotting factors? I will be telling to you about that very soon. Before that, let me tell you that hemophilia is an X-linked recessive disorder. Now, what is this X-linked recessive disorder? In case of males and females, males are represented by XY chromosomes and females are represented as XX chromosomes. In case of males, if they are inherited with a mutated X chromosome, they does not have another X chromosome to compensate that. So, they become affected with hemophilia. But in case of females, even if they are affected with or inherited with a mutated X chromosome, they have another X chromosome to compensate that. So, here they does not become affected with hemophilia, but they become symptomatic carriers. So here, what I meant is that in case of hemophilia, the males are the affected ones and the females are the carriers. But in rare conditions, in females, if they are inherited with both the X chromosomes mutated, then even females can become affected with hemophilia. Now, what I left there? What are the clotting factors that are affected in hemophilia? So, based on what clotting factors are affected, hemophilia can be classified into three. That is hemophilia A, hemophilia B and hemophilia C. Actually, we mainly say that there are hemophilia A and B. C is a very rare condition. Now, about A. The clotting factor that is affected in hemophilia is clotting factor number 8. So, it is the most common and firstly discovered one. So, if we tell it in a population, 1 in 5,000 males are being affected here. Now, hemophilia B, the clotting factor number 9 or Christmas factor is being affected here. So, it is also called as Christmas disease. 1 in 25,000 of the males are being affected in this. And C, as I told you, it is a very rare condition and it is seen in a population, very small population found in Jew, that is Jew community. So, now let's move on to the pathophysiology of hemophilia. As we discussed earlier, hemophilia is caused due to the deficiency of the clotting factors 8 and 9. Now, what causes this deficiency? This deficiency is caused due to the lesions in the gene that are responsible for making these factors and they are located in the X chromosome. Now, what is the role of these clotting factors in case of hemostasis? So, let's discuss that. In case of a trauma or a small injury, what happens is there is a disruption of the endothelium and that causes bleeding. So, to stop this bleeding, first of all, vasoconstriction occurs, then formation of platelet plug is there. Up to this, we call it as primary hemostasis. Now, this formed platelet plug is unstable. So, to stabilize this, we require clotting factors and this is called as secondary hemostasis, and this stabilization is done by formation of fibrin through coagulation cascade, which includes intrinsic and extrinsic pathways. Here you can see the intrinsic and the extrinsic pathways that are included in the coagulation cascade. So in this intrinsic pathways, what happens is that 9th factor along with that 8th factor activates our 10th factor, which converts prothrombin to thrombin, and thrombin converts fibrinogen to fibrin. This formed fibrin is also unstable and this is stabilized by factor number 13 that is activated by thrombin. So from here we can understand the importance of the clotting factors 8 and 9. Without that, factor number 10 would not be activated and the further steps will not take place. No formation of fibrin occurs and prolonged bleeding occurs. So this is the pathophysiology of hemophilia. Now let's focus on the clinical features. On the basis of severity, clinical features can vary. So based on severity, hemophilia can be classified into severe, moderate and mild. And here the severity depends upon the activity of the clotting factors. So in case of severe hemophilia, the clotting factor activity is nearly or less than 1%. Here what happens is spontaneous bleeding to joints occur, which is called as hemarthrosis. Muscle hematomas are also one of the clinical features here. And in case of moderate, 1 to 5% of the clotting factor activity is being seen. Here what happens is bleeding occurs even in minor injuries, and also prolonged bleeding can be seen after dental extractions, surgeries, etc. In case of mild, 6 to 50% of the clotting factor activity is being seen, and here bleeding occurs in severe surgeries. Other clinical features include GI tract bleeding, bleeding in the urinary tract which can cause hematuria and ecchymosis. Next is diagnosis. How to diagnose hemophilia? The first is coagulation studies. Activated partial thromboplastin time, which is related to intrinsic factor, is first being measured. So as 8 and 9 is related to intrinsic pathway, here the activated partial thromboplastin time will be prolonged. That is the first diagnostic method. Prothrombin time, that is being related to extrinsic pathway, will be normal, and bleeding time will also be normal. Platelet count is also seen to be normal. Now, factor 8 and 9 assay can also be done, which is the second method to determine whether it is hemophilia A or hemophilia B. Now, the third method is genetic testing, which is done to identify whether there is a mutation in the F8 and F9, that is factor 8 and 9 genes. Now, next is management and treatment. As a doctor, our primary goal is in prevention of the bleeding and then the treatment of bleeding episodes. So, what can we do to treat hemophilia? First is IV infusions. IV infusions of factor 8 and 9 can be given. It can be given either during the bleeding episodes or prophylactically to prevent the bleeding. Now, second is giving of desmopressin. In case of hemophilia, desmopressin can be given, which helps in release of the factor 8 from the endothelial cells. The third one is antifibrinolytic agents. For example, tranexamic acid can be given in case of mucosal bleeding. And the fourth one is gene therapy, like to insert functional F8 and F9 genes can also be done, which is long term. Now, there are also some supportive measures that can be advised. For example, avoiding NSAIDs to avoid intramuscular injections, to use soft toothbrushes to avoid bleeding, and also in case of joint pain, physiotherapies can be done. So, that's it. I hope that this video is useful for you people. Thank you so much.